Good evening. Dog owners are being asked to keep an eye on their pets as the city of Bakersfield Animal Care Center is seeing an alarming rate of dogs infected with distemper in their shelters and around the community. 23 ABC's Vanya Patino is live in Southeast Bakersfield with what you can look out for and what you can do to prevent it. Vanya.
That's right, Brianna. Well, distemper is a highly contagious animal virus which attacks the respiratory and neurological system, which as a pet owner myself is very scary. Now, the animal shelter says that they are seeing a lot of these cases in the community. So we spoke with a local vet about what you can do to keep your pet safe.
It's not something we've seen for a long time. All of a sudden, we've started seeing a lot more cases in Kern County.
Brooke Mills, a practice manager at Shira CT Pet Hospital, says there are 2 rounds of symptoms in distemper.
Like neurologic symptoms, which could be a head tilt or circling or chattering of the jaw. Okay. The secondary symptoms we're going to start seeing would be like respiratory illness, nasal discharge, eye discharge.
She says all dogs are susceptible, but some more than others.
If you have a pet that has an autoimmune disease, autoimmune disorder, or young dogs that are unvaccinated, a lot of people are like, oh, you know, I adopted this dog or I got this dog, he's 6 months old, he has no vaccines. Those are the dogs that are more susceptible to the virus, the young patients that have never had a vaccine in their system before in their life.
It attacks them and it is a very quick and sudden death. It's not long that it can take their life. Some of them can, you know, outlive it, but for puppies, it's almost inevitable that they're going to die.
Nicole Gitsky with the City of Bakersfield Animal Care Center says they began seeing an increase in infected dogs coming in about a month ago and are now receiving positive distemper tests almost daily.
We have stray puppies come in and they don't have that immunity. We don't know where they've been. They're getting distemper. And like I said, it's highly infectious. So when they're in the puppy ward, it's spreading to all the other puppies then. And it's really something hard that it's hard to grasp.
Although there is no cure, vaccines are your best bet at preventing this in your pet.
Stay on time with your vaccines. Puppies need to start vaccines at about 8 weeks of age. They're done by the time they're at 16 weeks of age with the puppy series, as we call it. After that, you're really looking to do your yearly annual booster vaccines, and that is the safe all for your pet.
Litters Without Critters is one of those that is hosting a low-cost vaccine clinic for those who are looking to vaccinate their pets. The Bakersfield Animal Control Center is also hosting theirs at the beginning of December, but those I spoke with say that you should vaccinate your pets as soon as possible. Distemper is not the only one that is spreading in our community. Pneumonia is also one of those diseases currently spreading. Coming up on the news at 6, where your dog may be contracting this virus and what you can do about it. In Southwest Bakersfield, Vanya Patino, 23 ABC News, connecting you.
Thanks, Vanya. And aside from distemper, there's also concern, as Vanya mentioned, about the spread of pneumonia in dogs. Plus, another major disease to worry about here is parvo. We took an in-depth look at both of these diseases and have details on what you need to look out for in your pet. According to officials from the Animal Hospital of Clemens, both pneumonia and parvo have similar symptoms to look out for. For pneumonia, those include difficulty breathing, lethargy, nasal whistling, wheezing, coughing, and runny nose. For parvo, severe bloody diarrhea, vomiting, red inflamed tissue around the eyes and mouth, rapid heartbeat, and a low body temperature. And both include high fever, loss of appetite, weight loss, and dehydration. Pneumonia primarily attacks a dog's lungs and their breathing. Parvo damages their intestinal tract and can damage their heart. If your dog has been diagnosed with either disease, you'll want to keep your ill dog away from other household pets and wash bedding, collars, leashes, and bowls frequently to avoid spreading the condition. Also, wash your hands immediately after handling or petting a dog with any infectious disease.